Today we're spending some time with Tammy Hopper. She's a speech-language pathologist who's agreed to share her expertise on communicating with people in the middle stage of Alzheimer's disease. Tammy, can you tell us a little bit about what a speech-language pathologist does?
Sure. Speech-language therapists, or speech-language pathologists as we're sometimes called, are masters trained professionals who have expertise in the study of human communication and its disorders. And as well, speech-language pathologists also deal with swallowing and swallowing disorders.
Why is communication so important to us?
Communication is how we connect with each other as human beings. And effective communication is essential for person-centered care and for forming the foundation for interactions based on dignity and respect.
I know that dementia can affect communication, and we can expect even more challenges in the middle stage. What is happening when someone who's living with dementia is having trouble communicating?
A lot of the communication problems that occur in dementia are a result of the cognitive problems in dementia. So in the early stages of, say, Alzheimer's type dementia, individuals will have difficulty, particularly with memory and new learning and recall of information. And what happens is that this worsens over time and other cognitive functions become affected. What we don't realize is how much communication relies upon intact cognition. So we communicate all the time and it's fairly effortless for most of us. But once you have Alzheimer's disease and the cognitive deficits that go along with that, communication can become very difficult because the complexity is unveiled, if you will, because the cognitive problems lead to the communication problems. Memory, for example, is central to normal or typical communication. So if you and I are having a conversation about something that happened earlier today, we can only really have that successfully, have that conversation if you and I both remember what happened earlier today. So if I'm asking you questions about how, for example, you spent your morning, you would be able to tell me because you have intact memory and you can attend to the conversation, you can remember what I've asked you. All of these functions that are seemingly easy for us can be very impaired in individuals with Alzheimer's disease because of those cognitive impairments.
So from a scientific point of view, what is happening to the brain and how is that affecting communication?
What happens early on in the disease process in Alzheimer's type dementia is that the pathology that causes the disease starts in areas of the brain that are important for memory, particularly important for memory. And then as the disease progresses, multiple areas of the brain are affected. Those areas of the brain that are affected are important for goal-directed behavior, such as conversation and communication and using speech and language for purposes like communication to meet wants and needs, to establish and maintain social relationships. That worsens, those abilities become more difficult to implement in everyday life as the disease progresses.
Some people get very frustrated when they're having trouble communicating or being understood. What sort of consequences do you see in your workplace when people are having ongoing trouble with communicating?
Oftentimes we see just what you said, which is one of the most common complaints of individuals with Alzheimer's disease and their care partners is that I'm really having trouble finding the right word to say. So when they might get certain words confused more often than others. They might make errors like saying salt instead of pepper or open a window instead of close a window. So there can be those types of issues with word finding.
Oh, interesting.
And confusions. We also see repetitive asking of questions or telling the same story over and over.
Yeah.
And again, that's directly related to the memory problems because oftentimes individuals with dementia will ask a question and then the care partner or communication partner will answer that question, but then because of those memory deficits, the individual with dementia will ask the question again because they can't remember that it's been answered already. Oftentimes in conversations, which can be quite cognitively challenging, knowing when to take your turn, knowing when to stop talking, knowing when to switch topics, remembering that a topic has been switched, remembering the context of the conversation. So what were we talking about a few minutes ago? Or if I asked you about what you did earlier in your day, you need to remember what you did earlier in the day in order to have a successful interaction if I've asked you that question. So I think all of those types of communication behaviors and language behaviors are affected in Alzheimer's disease. And that's what we know from the research, and we also know this from what individuals with dementia and their family members and friends tell us.
I've seen people with Alzheimer's have trouble trying to find a word. What other kinds of things might we see?
Problems sometimes with understanding very long and complicated sentences. So we see the difficulties on the comprehension or understanding side, as well as the production or expression side.
Some people get very frustrated when they're having trouble communicating or being understood. What sort of consequences do you see in your workplace when people are having ongoing trouble with communicating?
It is understandable that people become frustrated, both individuals with dementia and their communication and care partners. So when we have communication breakdowns, for whatever reason, it tends to lead to a number of, I think you would call them negative outcomes. And one is that we know that people with Alzheimer's disease, after having several frustrated attempts at communication, often start withdrawing from social communication opportunities. So that kind of social withdrawal from interpersonal interactions, and then this withdrawal can lead to isolation. And isolation is often associated with higher prevalence of depression. So communication problems do, or can sometimes result in health problems as well. And it's, we rely so much on verbal communication, using language and speech to communicate, that when it fails or it's disrupted, frustration is a natural feeling to have.
Can you tell me what other sort of things would be considered nonverbal communication?
Okay, so with our verbal communication, as I mentioned, speech and language and talking, basically. I talk, you listen, you talk, I listen. That's the essence of our primary way of communicating in conversation. But we also have this whole side of communication that is nonverbal. And this is related to things like gestures, facial expression, posture. All of these, touch is a very powerful form of nonverbal communication.
That makes sense.
Yeah. These are all different types of nonverbal communication. And oftentimes we forget about their importance, but they're really integral or important to consider as we have more problems with verbal communication in situations as in Alzheimer's disease.
Now, I know that everyone experiences Alzheimer's disease differently, but generally, people in the middle stage, what are some communication things that they can still do?
That's a great question, because I think it's easy for us to focus on the losses that occur in Alzheimer's disease, because there are so many of them and they can be devastating. However, when it comes to communication, there are still many aspects of communication that could be seen as relative strengths. So one of the things is that most people in the middle stages still have a desire to communicate, so still want to have that interpersonal interaction. Also, many times reading is preserved to a certain extent. So not for long and complex material, but for shorter items, sentences, words, maybe short paragraphs. Also, interestingly, people in the middle stage can usually reminisce about memories from their remote past. And these may be stories that they've told repeatedly about their life, big life events, for example. And they can, with some cues and prompts, they can still remember some of that information and share it in a kind of a storytelling way. So the reminiscence and the access to those remote memories is a great way to have a conversation when someone may not be able to remember what's happening in the immediate.
Yeah. Thank you so much for this, Tammy.
You're very welcome. It was my pleasure.